But what you need to know is that the aim of the NRM is not just growth, but transformation, socio-economic transformation. It is now, but before I talk about other things, I want us to solve this little problem of Ebola. Ebola is a very simple disease. It is not like Corona, as I said last night. Corona was very dangerous because it was spreading by breathing, which meant that if you saw the other time, I got Corona from you people in Chankwanzi. When I took a group photograph with you people without my mask, I got Corona. And I was here for 21 days sitting in the house. So Corona was really dangerous. It was spreading by breathing. But this Ebola spreads only by contact. And contact, close contact with the sweat, with the vomit if they vomit, with the blood, sexual, kissing, saliva. When the person is already sick, not showing symptoms of sickness. So therefore, really, it can be stopped. We just need to get rid of the carelessness. I'm really, I don't like people who don't take life seriously. Because if you want to achieve what you want to achieve, you must be very serious with your life. And part of life is health. If you have good health, you can be able to do what you want to do. The other day I was here, I was seeing you shaking hands, hugging. These are members of parliament now, setting a bad example for all these Africans to get sick and then go in hospitals and so on, or die even. So please, I want to use this occasion to appeal to all the Ugandans to really finish this little problem of Ebola. Ebola is not a serious problem. Yes, there's no vaccine against Ebola yet. There's no direct medicine, but it is very easy to avoid, number one. And number two, even when you get infected, if you report early by controlling the temperature, by controlling the rehydrating you when you vomit and sweat, you can recover, like these people have recovered. So let's I appeal to all Ugandans to solve this little problem. Our brothers and sisters in Congo were coming through the borders. We stopped the buses and passenger vehicles. We won't allow cargo, lorries and petrol tankers and so on. But people were coming through the border, the Panya. That's why we have discussed with the Congo government, and they have allowed us to work with them to open medical stations inside Congo near the border and announce, invite our Congolese people, anybody who is sick, come here, don't try to go to Uganda. Because when you go to Uganda, you waste time, you lose time, come here, this is nearer, and we are doing the same here as we are doing in Uganda. So we hope to finish this little problem of Ebola. So therefore, what we said the other time here, now that especially there's this money which is already there in the villages, all the leaders, certainly all the ministers, must take the lead in checking parish by parish what is happening, to make sure that all these people stop kukongora, stop cheating us. We work, they don't work. They are there, but they want services. They want medicine, they want education, they want security, but they don't contribute. They're just sitting there in their homes and not engaging in the money economy. So although we have done very well, this very good performance the minister is talking about is by the 67% now. And all of them, not necessarily with the Chibaro. Some of them do without the Chibaro. But there are 33% who are Wako Pembeni, they are on the side. Suppose they were also part of this, would be much further. And as the minister has told you, these people joining the money economy is crucial for two reasons. First of all, they get income. They get income, which means that their purchasing power goes up. Part of the problem of the purchasing power being low is because they don't have income. So therefore, this budget is no more Kongora. No more Kongora. No, Kongora is when you work and others just lean on the hoe in the village. No more Kulala. As you heard, a big budget, part of the budget is on infrastructure, on the roads, the railway, the pipeline, the airports, the waterways, electricity, irrigation. These are all, as the minister was saying, enablers to enable production to be done cost effectively, low cost of doing business in Uganda. Now, then the other challenge is on the service delivery. Again, that's where you, the leaders, must come in. Because medical care, Health Center 3, is in every sub-county. These sub-counties are in Uganda. They are not in Congo, they are not in Kenya, they are here. Why should there be no medicine in the health center? Maybe that medicine has been stolen, but the member of parliament doesn't know and doesn't follow up. And people are crying. Then you have the government officials, the Gombora chief. That's why the local government must be very, very strict. The Gombora chiefs, what are they doing? The GISO, there is somebody called the GISO. Have you heard of somebody called the GISO? He's also there. Drugs are being stolen, GISO is there. This is what I can no longer tolerate.